And the people, let me try to extrapolate to the dogs and the cats and the horses, and they were getting better. Matter of fact, here it is 40 years later, and I'm retired from active veterinary practice, but I still get emails from clients saying, you saved my dog with brain cancer, 20 years ago, or you saved my dog with this cancer 20, 30 years ago, and now I have an older dog, can you help? And, I tell them, I'm retired, but I will sometimes help some of my older long-term clients just with sharing, not as a consult, but just, advice saying, well, I found that this worked and this worked, and you might want to check with your veterinarian, or a holistic veterinarian,
And it's hard. It's hard to find someone who's well-versed in all the modalities. There are many vets that do acupuncture and many vets that do chiropractic, but to find that combination and with the experience and with adding in the Chinese herbs, I mean, I've seen animals' lives saved with those Chinese herbs. They're really powerful.
Oh, yeah, for sure. I mean, the last veterinarian that I mentored one-on-one that did an internship with me, she's one that I refer my old horse clients to back in New York and Connecticut because she got the download, the mind meld of me of 40 years of experience. And it's true, there's so many clients call, there's so many veterinarians out there, both in equine and small animal, who've just taken the training, but they don't have the experience of combining it all in 40 years of knowing where it can work and where it doesn't work. And I feel frustrated and saddened by that sometimes too, and that's why I still teach and lecture periodically, trying to share that knowledge, still.
Yeah, it's really important to be able to have the new vets have that opportunity to learn about holistic modalities. I still don't think most of them are taught in vet school anything about holistic work, are they?
No. I mean, it's nice to see that some veterinary schools have started with some introductory courses and stuff. And like when I was a professor at Colorado Vet School and Tufts Vet School, I would give lectures to the vet students as well as postgraduate veterinarians. And, when at Cornell, I was giving the veterinary students for 6 years, I was giving them a little mini 2-day training, intensive training on acupuncture just to get them, interested, and realize, oh, this is something we should look at more, and so here and there, and, there are veterinarians at different veterinary schools now who do lecture on it to the vet students, but it's maybe an hour or 2 or 3 hours in their whole.
Yeah, at least they're getting exposure,
but
though.
At least, yeah, well, that's what I feel, is at least you're showing them, one, it's accepted enough that there are lectures in your curriculum, and that if you want more, there are lots of postgraduate programs, And right. I'll still get invited different places to go and give introductory training programs, and I still love doing that, I was giving one in Singapore and gave one in Japan and, throughout the world in the last couple of years, and things like that I still love doing.
Alan, tell me, you've been doing this for so long, and, one of the cornerstones of alternative and complementary medicine is that holistic approach, which gets back to that idea of self-healing and allowing the body to self-heal. Can you give me some examples of animals that you might remember seeing that self-healing mechanism in particular prompted by the alternative modalities that you provided?
Well, I think all healing is self-healing. And that's a generalization, but if what we try to do is just help the body's innate immune system and innate healing abilities come back into balance, So let's take say a dachshund with a slipped disc and compressed vertebrae impinging on the spinal cord, okay, and they're unable to walk, and because it's multiple areas, they say, oh, this isn't really a surgical case, and you do acupuncture on it, and it immediately starts relieving the spasms between the vertebrae,
right.
and increasing the microcirculation to the area, which then has all these different anti-inflammatory mediators in the blood, and you're increasing the oxygen and the nutrition to the area. So essentially it's helping that area heal. And it's also stimulating the nerves, helping them regain function.
Right.
So that's probably a classic, And on horses,
sadly all too common. And then you can add in the chiropractic and the exercise and balance that you can now do with the dog, because the acupuncture started the process of him being able to accept additional work.
Exactly. And the horses, probably the classic example is chronic back pain, and when I do a holistic integrative evaluation, I look at the whole picture. I say, not just say, there's back pain treated. So where's it coming from? Okay, is it coming from lower leg lamenesses? Is it coming from the rider? Is it coming from the saddle? Is it coming from the training? Is it, where is it coming from? And then once we can find that out, and you try to decide, is it primary or secondary to something else, and then you address the primary issues, and then you can use the acupuncture again to relieve the muscle spasms, increase the circulation back there, relieve the pain and the inflammation, and then they're pain-free and they can function, and then they can build the muscles up to hold the back, to make the back stronger. But again, that's a classic example of the holistic integrative approach. You may need to inject the hocks or inject the joint, because that may be the primary cause. You may need to correct the shoeing. You may need to correct the saddle fit. You may need to work on the rider. I would tell the riders, you may want to go see an appropriate healthcare practitioner to get yourself back into balance,
Right. That makes such a difference.
Yeah. So it's really, the holistic approach is looking at all the different possible causes, and then looking at all the different approaches you can use, combining them appropriately to help the animal heal. These days there is also, other things that are starting to show up that we have to look at, that Western medicine really isn't looking at much, like the impact of electromagnetic fields and on our health, and on the health of our animals, and there's so many newer things. And then, the challenges with different pesticides and different food additives and this and that, and what that does to our GI microflora and to our overall health. So again, it's looking at the whole bigger picture.
Right,
and,
the whole system, the system of the horse and rider, and then the system of the horse and his environment.
Yeah, so that's where I still, a lot of this isn't even considered veterinary medicine. It's just, being an animal health coach and guiding people in the right direction to look at things,
Well, it's time to take another break to hear from our sponsors. You are listening to Dr. Judy Morgan's Naturally Healthy Pets with physical therapist for pets and people, Sally Morgan, on DreamVision7Radio.com. We'll be back with Dr. Alan Schoen in a few moments.
Interested in learning more? Visit physical therapist Sally Morgan's website at sallymorganpt.com, where you will find details about her upcoming speaking engagements, craniosacral therapy, and Tellington TTouch offerings, as well as information about holistic care for animals. Join the mailing list today and be the first to learn about upcoming events and special offers. Sally Morgan is a best-selling author, and her book, Dances of the Heart, Connecting with Animals, details her journey of learning to listen to animals. Her unique set of animal connection cards offers 52 activities to enhance your relationships with the animals in your life, and she suggests that you ask your pet to choose a card each week. Both Sally's book and her cards are available on Amazon and her website, sallymorganpt.com. Join Sally Morgan PT CST Daily on Facebook for conversations with a corgi, and visit YouTube for past episodes as well as Sally's TED Talk. When it comes to our pets' health, you can never be too careful. We invest significant time in ensuring that they have long and happy lives, but it's important to invest the same dedication into our own longevity. The key active ingredient in Dr. Morgan's wellness formula, pure New Zealand deer antler velvet, is now available as a standalone human-grade product. Life Deer Antler Velvet is a whole food supplement rich in calcium and collagen to support healthy joints and strong bones. Our products prioritize purity, ethical harvesting, and quality sourcing above all else. Visit lifepurerecovery.com to learn more and order your first bottle today.
Tune in to world-renowned author, speaker, and holistic veterinarian Dr. Judy Morgan, and now radio host of Dr. Judy Morgan's Naturally Healthy Pets on syndicated Dream Vision 7 radio network every Monday and Tuesday, 7 a.m. and 7 p.m. Eastern Time. Not sure which vaccinations should be given or how often? Not sure which food is best for your individual pet? Find out the answers to your questions in this weekly show where Dr. Judy interviews top experts and showcases the latest products that will help your pets stay naturally healthy.
Does your dog have bad breath? Tired of spending money on expensive dental procedures? Try out Dr. Morgan's Dental Drops today and save money while maintaining your pet's oral health. With New Zealand deer antler velvet as the primary ingredient, Dr. Morgan's Dental Drops are effective for treating stomatitis, gingivitis, and ulcers. You can purchase Dr. Morgan's Dental Drops directly from Amazon Prime or from her website, www.drjudymorgan.com.
This is Dream Vision 7 Radio Network, uniting mankind with universal love. Our shows are created from the heart, bringing each listener to a place of divine enlightenment. Breathe, relax, and enjoy. Let life flow.
Welcome back. You're listening to Dr. Judy Morgan's Naturally Healthy Pets, and I'm holistic physical therapist and Dr. Judy's sister, Sally Morgan. And here we are with our guest, Dr. Alan Schoen, who's been telling us about the history of alternative medicine for animals. And one of Dr. Schoen's newer projects is something called compassionate care for animals. Can you tell us more about that?
Yeah, well, what I started finding after 35, 40 years of practice is that so much of veterinary medicine and so much of just the world is focused on finances and financial reward and this and that, and that the heart connection to our animals, which is the essence of the whole human-animal bond, was being ignored. And I, just started asking everyone, saying if we don't ask the right questions, you won't get the right answers. And that the question that we should always ask, what is the most compassionate approach for this animal in this situation with this family, that they live with. And if you start boiling everything down to what's the most compassionate choice, boy, you really get into your heart space, and then you say, okay, is this surgery or is this drug, what are the cost-benefit ratio, but also what is the risk-benefit ratio of these different things? And it makes you start looking at things differently. And then, after 40 years, again, of practice and going in between different horse barns and animal hospitals and animal shelters, I started, realizing that there's this feeling, like, for instance, I'll give you an example. You go into one horse barn, I'm sure you've felt this too, Sally, is you go into one and you go, oh, boy, no one's happy here. The horses have their ears back. There's, like, really heavy metal music. The grooms aren't happy. No one's happy. And you go into another one, you go, oh, wow, I love coming to this barn, and everyone's happy, and the horses are happy and everything. And the same with going to different animal hospitals, and I started, and animal shelters, and I started saying, wow, okay, what's the difference here in these? And, you talked about feelings, and this and that, but everyone said, oh, that's a little woo-woo. But, over the last 10 years, I've started presenting, and just in the last few years, my new theories on this, based on integrating the latest in neuroscience and quantum physics with the human-animal bond. And, what I started putting together is realizing that based on the HeartMath Institute, where you could measure the electromagnetic fields coming off the heart when you're feeling love for others versus feeling fear. And the fear contracts the heart, decreases circulation.